Hi, my name is Gabriel Caluzzi, and I'm going to talk to you about a paper published in the Sociology of Health and Illness, written by myself, Dr. Sarah MacLean, Dr. Michael Livingston, and Dr. Amy Pennay. So the background for this paper is based off trends showing more young people are abstaining or drinking proportionately less than young people of previous cohorts. And we're looking at this trend happening in Australia, but it's also been happening in a number of places across North America, Europe, and the UK. So this paper is using data from interviews with 50 young people aged 16 to 19 who drank little to no alcohol. And we're really interested in how they constructed and talked about health. So we ended up finding that healthism, this cultural imperative to be healthy in everyday life, was a really useful framing for our data. So using this lens, we found three themes. The first was that alcohol was considered a risk to health. So this included short-term risks such as being sick, falling over, interpersonal violence, as well as long-term risks such as issues around cognitive development, chronic health issues, mental health issues, and addiction, which was really quite stigmatized amongst our participants. The second theme we found was how young people talked about their everyday health practices, such as diet and exercise. Here, drinking was framed as quite negatively because it didn't provide any kind of physiological benefits to participants, and it was sometimes grouped alongside other drugs as oppositional to maintaining a healthy lifestyle. In this day-to-day health, there were also some tensions though, particularly around mental health and social well-being, where alcohol was seen to be able to enhance mood and create intimacy in social situations, but could also depress and damage relationships. So the final theme was that we looked at the sources of health communication for our participants, and these were the media, school, and parents. So the media tended to create this really salient link between risk and alcohol use, whereas school tended to promote this sort of sense of personal responsibility when young people were drinking. And on the other hand, parents tended to take more of a harm minimization approach, encouraged delaying drinking amongst their children, and tended to monitor them on a night out. And all these sources sort of came together to construct young people as vulnerable to the effects of alcohol. So this need to be healthy was really integrated into the daily lives of the young people in our sample in ways that enabled other discourses around addiction, neurovulnerability, risk, substance use stigma, and personal responsibility over health. Also because physical health, mental health, and social well-being really tied together into this more holistic idea of health and well-being. This encouraged new ways of thinking about alcohol and challenged some of the values around heavy drinking. Thank you for watching.